Hey guys, good evening. Hope you can hear me loud and clear. It's another Wednesday evening, and you're live on Wellness 360 with me, Dr. Kelvin. And it's going to be an awesome. We're going to have an amazing time. We're going to learn so much about ourselves, the human body, and also we're going to learn how to apply, how to live healthier, and how to deal with cancer and a host of other things. So I'm sure as Instagram is gathering the followers, it's going to be awesome. It's going to be awesome. If you have any question, if you have anything you want to ask or anything you want to be addressed on this live, you can type it up in the comment section, or you can inbox it to me. And as soon as our guest is ready, she's going to come join us, and then we're going to have an awesome time together. So welcome. As you join us, you can invite your friends, share in your stories. Drop some hearts. Let me know that you can hear me actually. So drop some hearts in the comment section if you can indeed hear me. It's going to be an amazing session tonight. Welcome, Redu Caleb. Welcome to Ivy Del 1, Equia Jawa. Ranty Fitness is in. Good to have you join us. I'm going to add you shortly. It's going to be awesome. I'm sure as Instagram is gathering the followers, we are going to have an awesome time together. We're going to learn so much about our bodies. And like I said, the link between exercise and cancer and what you need to do about it is going to be amazing. It's going to be awesome. It's going to be informative. I mean, that's the most important thing. Information is what we need. Information is what we need to make decisions. And so as we get information, as we get more knowledgeable, it's going to definitely benefit us in the long run. So I'm happy that you are here with me. It's 6:20. It's time for us to get started. And so I'm going to add inviting our guests to join us so that we can begin our session. We can begin learning about our body and the topic, as I said, exercise and cancer. Good to have you here, Woiram. How are you doing?
Hi, Kelvin. I'm good. How are you doing?
I'm very, very well. I'm very, very well, and we are honored to have you join us on Wellness 360.
Thanks for having me.
Wonderful. So, quickly, let me introduce this amazing lady. She's Woiram Almarante. She's a physiotherapist. I mean, certified physiotherapist, not just any way cyclist. And she's also an ergonomist. And I mean, my first question is going to be, who's an ergonomist? But we'll get to that shortly. In fact, I have two questions that I need to be addressed quickly, but we'll get to that shortly. So Woiram is actually my mate from university, and she's an amazing lady, and she's been doing a lot of good work. She's been a lecturer. She set up her own business on the side as well, and she's doing a lot of amazing things. So tonight we have her here to give us a lot of information when it comes to exercise and posture and cancer and all those things. And so a virtual hand clap for you, Woiram. Thank you for joining us this evening. All right. So guys, I mean, we're going to get started, but if you can hear me, I'd like to know whether I can hear me or not. So please drop some hearts if you can hear me loud and clear whilst we get started. Thank you very much. Okay, so Woiram, my very first question, as I said. So that's the first of two. These two questions are for me personally. So who is an ergonomist? Like what does an ergonomist do?
Okay, so an ergonomist is somebody who is certified or has training in ergonomics. And ergonomics is a science that deals with how you can use research, usually to observation and other analytical methods, to find solutions to people's problems. Usually it's workplace related mainly, but there are a lot of sectors that you can use ergonomics in. But basically, the aim of ergonomics is to reduce the risk of injury among people, such that the environment and the tools or anything they use at work or at home or with any machine they use, that risk of injury is reduced. So it's
Okay.
basically the interplay between the human, the environment, and tools or processes. So all this is
Wow.
to help the worker mainly, or the person who's using all these equipments, so that they can not fall sick or have musculoskeletal disorders or back pain and all these aches and pains that we have once we
Wow.
are able to work.
Wow.
Yeah.
Well,
So to
that,
help
that,
them to execute their work safely, basically.
wow. So that means that we all need an ergonomist in our lives because I mean we all work with tools and we all trying to
Yes,
do more work.
yes, you do.
Wow, wow, wow. Well, thank you very much for that. Now, my second question, again, this is my question.
Okay.
Now, and we spoke about this earlier. What's the difference
Yeah.
between a physical trainer and a physiotherapist?
Okay. So physiotherapists or physical therapists, depending on where you are persons who are trained, and they're allied health professionals, first of all, and they are trained to be able to promote movement and restore function in persons. Usually, they have the skills and the knowledge in the clinical setting to be able to do a physical examination and come up with physical diagnosis and then a prognosis and have a plan, like a treatment plan, using physical tools or physical elements so we have like ice therapy, heat, manual mobilizations. It's mainly physical means or methods to give the patient or the client relief or to rehabilitate a client in the case of if it requires physical rehabilitation. So generally we are like supposed to help people to be able to move and function, but we also do some patient education as well and health promotion. So we advocate for how people can live their lives in a way not to put themselves at risk of non-communicable diseases and other conditions like stroke, back pain, and the rest.
As for
So
the back
that's
pain,
it
as for the back
basically for
pain,
physio.
as for the back pain.
Yeah, that's for physiotherapists. But physical trainers, usually more often than not, they are certified. So they go to a course that gives them a certification to be able to create and execute fitness plans for apparently healthy persons mainly. Okay, so they have like training in nutrition and some training in exercise programs and management, stress management, basically. So that's the
Okay,
difference. So
okay.
physical trainers are for apparently healthy people, and physiotherapists or physical therapists are for unhealthy, more of unhealthy. Even though we have training for healthy people, but we focus more on unhealthy people. So that's the main difference.
So that means you can actually switch from unhealthy to healthy
Yes,
people.
yes. So
Okay,
usually,
okay,
physiotherapy has a lot of specializations. Like we have
okay.
pediatrics, neuro, orthopedic and trauma, sports. So people who are usually sports physiotherapy based usually pretty much can train healthy people and go to fitness programs and the likes because they
Nice,
deal
nice,
more
nice,
with healthy people like athletes and the likes. So yeah. So you can
nice.
a physiotherapist can pretty much perform the functions of a physical trainer to some extent, but a physical trainer cannot work in the clinical setting. That's the difference.
Okay, okay,
Yeah.
that makes a lot of sense now.
Yeah.
All right. So let's dive into our discussion for this evening, and we are talking about exercise and cancer. Well, the
Yeah.
question on the question is, are they connected or is just hype? So you tell us.
Okay, so it's not a hype. It's not a hype. They are actually connected. There is research and evidence to show that there actually is a link between physical activity or high levels of physical activity and lower risk of cancer. So because now we are all shifting to evidence-based um,
Yeah, yeah.
medicine. Yeah, so we want to cause cancer is kind of fairly new, and we are still researching as to the causes and how people have it and how people are able to recover from it, what happens after they recover, and all of that. So it's still ongoing. So we look at a lot of evidence-based research, or we do a lot of evidence-based research, and according to this research, it's been shown that high levels of physical activity have been linked to lower risk of cancer, certain cancers. So it's mainly breast cancer, bladder cancer, colon cancer, kidney cancer, endometrial cancer, esophageal cancer as well.
Wow.
Mainly. So these types, yes. So
Wow.
research has shown that persons who were involved or were engaged in the highest level of physical activity had ranging from between 12% to 23% lower risk of cancer. So
Well,
it's quite,
that's very significant.
yeah, it's quite significant. So yeah, it's not a hype. It's actually shown that there's a link, and these are from observational studies. So it's like them observing people. Some of them have recovered from cancer, and they are still observing them, and some they've observed them and their life, them the way they live, and their risk as well, to realize that there's actually this link.
So
So
if I understand you correctly, I mean you are saying that if you are active, like if you are physically active or you involve yourself in exercise, your risk
yeah,
of developing cancer is lower.
it's lower than somebody who is not involved in
Wow.
physical activity. Yes.
Okay, okay. Well, I mean, well, guys, you've heard it for yourself. So it's not hype at all. I mean, there is
No.
actually a connection between exercise and reducing your risk of cancer. So hey, let's go out and exercise. But then that brings me to my next question. What
Okay.
exactly? Well, I don't know if I should ask what is exercise. Is exercise just getting
So
up and?
okay. So there's a difference between exercise and physical activity.
Aha,
There's a
please
there's,
tell us.
so there's a difference. So I'll say exercise falls under physical activity,
Okay,
but physical activity isn't exactly exercise. Okay, so the difference is
okay,
that physical activity is mainly any activity or action you perform or movement you perform that uses your muscles. As you move, you use your muscles to expend energy. So
okay.
the most minimal thing you can do with your muscles, even if you are sitting, it's classified as some form of physical activity, by sedentary physical activity, because you are using very little energy. You are using below 1.5 metabolic equivalent of the task. So it's very little. So it's sedentary. Um,
Okay.
let's say if you are doing an activity like walking the dog or playing with
Mhm.
your kids, or even mopping the house, cleaning the house, sweeping the house, lifting chairs. All those are actually physical activities because you are using muscles and you're expending energy. Some of them you getting quite tired
Yeah.
and breathless. Okay, so the difference between physical activity and exercise is that physical activity is more like freestyle, but exercise is planned, structured, it's usually repetitive, and it has a purpose.
Okay. So exercise is planned, is structured, and it has a purpose.
Yes, and it's repetitive. It's like you're doing the same thing because your purpose is maybe you want to tone your abs. Your purpose is centered on your abdominal muscles.
Yes.
You want to firm your glutes. So the purpose is centered on firming the glutes. So there's a purpose to it. But physical activity is like you just want to expend some amount of energy. Usually you want to expend more than you have consumed in terms of food.
So it's so okay. So just again, just to clarify, so is it good to do physical activity or it's better to do
Yes.
exercise? I don't know which is which.
Okay. So the thing is depends on the person. So let's say if you've already cultivated the habit of exercise and you're already like somebody who is fitness centered or you're athletic, then you can engage in an exercise on a day-to-day basis without really feeling like this is something I have to work or I have to find time for it and I have to miss out on other things for, because it's part of you.
Yeah.
But if you're not that type, then physical activity you'd have to center on just using your physical activity to get to expend energy to reduce your risk of cancer we are talking about. So if you are somebody who's just like most majority of us or the general population who's not really exercise centered, you would want to use your daily activities that like gardening, um, just taking a stroll, walking, sometimes walking briskly. That's depending on the intensity. So we'll get to intensity in a bit. So you can use some of these activities, walking the dog, playing with your kids, household chores as physical activity. Okay. And you would still expend some because this is actually moderate physical activity, these activities, because you do them for a period of time for at least 20-30 minutes. Yes. So that kind of activity, if it's done consistently, you'll be able to lose weight and you'll be able to stay fit.
And I think last week we already drew a connection between being overweight and cancer. So then now if exercise or physical activity can help you lose weight, then it means that
yes,
it will definitely help you then beat cancer on 2 levels, right?
Yes, because obesity has been found to be associated or linked to cancer, so certain cancers. So it's best to try to lower your body weight pretty much, because if you're obese, it means you have a BMI, body mass index, of above 30.
Yes.
So it means that you're quite heavy. It means that your weight over your height squared is still big. So if your weight is big, definitely your BMI won't be big. So you would want to reduce that.
Yeah. So let me just chip this in. So I mean, as a physiotherapist, apart from cancer, so we know being overweight and being obese is not good in terms of cancer, but what are some of the other issues that you are going to face if you are overweight or if you are obese? I mean, speaking from a physiotherapist point of view.
Okay. So when it comes to even let's say the spine, you realize that the body, if you are heavy, the body exerts some force on your spine. So if you are heavy, you would already have constantly some force being exerted on your spine and your discs. So and your joints, all your joints, your knees. So if you're a very heavy person, or if you're obese, you would sometimes end up over a period of time. So usually sometimes there's a trend that has been noticed that people who are usually very, very hefty or big tend to, if they are that inactive, tend to have conditions like knee pain, osteoarthritis, and the likes. Okay, so it would definitely have an effect on your joints. And so in that sense, still being obese or overweight physically is not the best, because then it could lead to pain and musculoskeletal disorders generally. Okay. Yeah. So not to mention also you being obese and you having to probably be at risk of cardiac conditions and the likes, those kind of things. So there's a lot to it. So being physically active actually is something that we should incorporate into our daily lives, because there's so much advantage to being physically active as compared to not being physically active.
Yeah, indeed, I agree. So with physical activity, exercise, at least now we know the difference. And again, if I understood what you said, exercise is repetitive, and it's towards a specific purpose. Yes. but then again, just being physically active, there's a purpose to it. If I'm sitting down, I mean, I'm relaxing. That's my purpose.
Yes, but we are looking at how much energy you're expending.
Okay, fine.
Yes,
You're trying to convince me that I should get up and exercise. Okay, I've taken it.
Yes, it's not bad to be sitting, because I mean most of the times our work requires us to sit for long hours, to be sedentary. But it's like when you get off work, maybe instead of if you have an office that has an elevator, for instance, instead of you taking that, you can actually walk, like use the stairs, those kind of things. And if you want to go and buy something in your neighborhood, you might probably say, oh, let me just walk instead of like taking the car from point A to B. I might probably want to walk, so I can expend some. So that's why people end up wearing Fitbits and trackers and the likes, because it's able to track the number of steps you take, so that okay, I've reached my 10,000 steps that's recommended per day. And you're like, yay! Yeah, that's the reason. Because we want to be able to track our physical activity. Okay.
I came across a research some time ago. I don't know if you have ever come across something like that, but it says that so assuming you were working as part of your work,
Yes.
So let's say you walk 1 kilometer from your house to work every
Yes.
morning.
Mm-hmm.
Versus if you just got up and said that I'm going to walk this 1 kilometer as exercise. I mean, the research was trying to suggest that if you actually did it as exercise and not as part of your work, you actually you kind of burn, like your body receives it better. You tend to burn more calories, and
Then
the general outcome is better. I don't know if you have come across any such information.
not exactly, but I think it makes sense because if you know you are engaging in exercise, you are already conditioned. Okay, so mentally you're conditioned. So with the kind of zeal or the kind of effort you put into it, it's different from if you were just leisurely. You're like, oh, every day, okay, I know I walk this 2 miles or 5 miles or whatever. I know I walk this much every day, but you're going to just be doing it like it's just an everyday thing. But if you know that, oh, between 5:30 and 6:30 every day, I'm going to do this, you put more effort into it, you'll be more specific. You know
Yeah.
exactly what you want out of it. So that kind of makes sense why the outcomes will be different. But in this current time, it's even tough for people to actually set aside time to
Mm-hmm.
do exercises.
Yeah.
So that's why, like, we're advocating for physical activity. Like, use the normal activities you do as a form of fitness, or as a form
Yeah.
or a way for you to maintain your activity level and reduce your risk to
And I agree totally.
conditions.
I agree.
Yeah, yeah. So that goes to the recommended physical activity.
Yes,
Okay.
please tell us.
So yeah. So it is recommended that in a week we should all try to do 150 minutes of moderate intensity physical activity.
150 minutes.
150 minutes. So ideally exercise shouldn't be like back to back to back to back because your
Okay.
body needs to recoup. So you'd want to break it into, let's say, 5 days. So it usually should range between 3 to 5 days. So if
Okay.
150 minutes in 5 days, it means that it's 30 minutes a day, 5 days. So 30 minutes every day for 5 days. Or if it's 3 days, you want to do it today, take a break, next day, take a break, next day, take a break. It means that you'd have to do 50 minutes or 45 minutes, 50, 45 minutes, okay, three
Yeah.
times a week. Yes. So like that's supposed to be like the minimum you're supposed to do.
But when you say moderate intensity, so does that mean that I should go to the gym and go and lift weights?
Okay, so there's a quick way we can determine moderate intensity and vigorous or high intensity. So we
Okay.
have a scale called the rate of perceived exertion scale. So for that, if you are engaged in moderate intensity physical activity or exercise, you will be able to, it's exercise or activity that you're doing, your heart rate has increased, and you know that you are definitely doing something a little bit more strenuous. You are breathing deeply, and
Okay.
sometimes your temperature will be warmer. You start to feel warm, okay, because the blood is going through circulation. And you'll be able to actually talk and have a conversation. That's moderate intensity.
Okay.
You can talk, but you cannot sing.
Okay.
So,
Oh, okay.
so yeah, that's moderate intensity. So, I mean, right now I can sing. Like right now I'm not doing anything, so I can sing la 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 la. But if you're actually doing moderate intensity physical activity, you won't be able to sing. Like you'll
Okay.
be you can't do that. You'll be talking, you'll be able to talk, but as to singing, you can't sing. But you'll be able
Okay.
to talk.
Okay.
But when it comes to high intensity physical activity or exercise, you will be able to talk, but you have to break. So if you want to, so yesterday when we were there, because yeah, that's how you determine if it's high intensity, because your heart rate has risen or has gone higher, and then you are
Okay.
taking deeper and deeper breaths. Okay, so it's harder for you to actually string out a full sentence. Okay, so that's how you determine. And if you want to exercise, the alternative is if you want to do high intensity exercises or vigorous exercises, you would have to do just 75 minutes a week.
Okay.
Okay, so if it's moderate intensity, you want to go the easier way, you would have to do 150 minutes a week minimum. But if you want to do high intensity, then you have to do just 75 minutes a week.
Okay.
So if you spread 75 minutes a week across 5 days, that's like 15 minutes, right?
Yeah.
That's 15
That's
minutes, pretty
manageable.
much. That's manageable. So it's not bad. You can do it. So and that's when the HIIT exercises come in. Cause
That's the what?
the HIIT,
The
high
hit.
intensity interval training.
Okay, just hold on a second. Let's bring in our audience. I mean,
Okay.
guys, if you're on this live and you're having a good time, you can drop some hearts. Let's see that you're actually enjoying it. If you have a question or a comment as well, you can drop it in the comment section so that we can. I mean, the guest William can read. I can read as well. So feel free and be a part of it. Don't be boring. If you have a question, drop it in the comment section.
Okay.
If you're enjoying it, drop some hearts in there as well. Let's see so that we know that indeed we are having a good time. Thank you very much for that feedback. Awesome. All right, so William, you were telling us about HIIT. Please take it away.
Yes.
Is it like the HIIT musical or something?
Oh no, HIIT. HIIT. So that's high intensity interval training. So
Okay.
you take about 4 or 5 activities or 4 or 5 types of exercises, and then you pace them. So you perform one activity for a period of time, take a short break, like a minute break, and do the next one, different exercise or activity, take a break, do the next one. So by the time you finish, you probably would have reached your 15 minutes, but it's
Yeah.
high intensity. So you are doing like knee highs, you are doing jumping on the spots, you are doing jumping jacks, burpees, you can do push-ups, you can do abs crunches. So you just have to vary it and have a short break so that you have the maximum benefit or the maximum effect from that type of exercise. And that has
Okay.
proven to be very, very effective too. So it's either you choose the slower or the moderate exercises for a long period of time, or you choose the high intensity or the vigorous exercises for a short period of time. And also it depends, because sometimes as we are aging, sometimes some of these exercises, the high intensity ones, we might be like, oh, my knee, oh, my back.
It's
So
not
I
easy.
mean, yes, you probably have to stick with the one that is going to give you less of an injury or less discomfort. So
Yeah. But I think
there's a
you
variety.
you also growing, like it grows on you. As in, if you have challenges this time, as you keep doing it over time, you get better at it. Your body readjusts.
Yes, in a way, but you must do it in a way so that you don't injure yourself more in an
This is
attempt
why I
to.
say everybody needs an ergonomist in their life.
Yeah. So, but the goal is just that you should be active. You should be physically active. Try to cut down on TV time watching TVs, time. So probably if you might have a tight schedule, you sit for long
Yeah.
hours during the day, but you might want to find a way to be able to pace up and down. So maybe instead of you saying, oh, bring my lunch to me, bring this to me, you probably should walk and just go and get the lunch, just as a means of being active. You
Yeah.
can
Yeah.
take that time off to do that. I mean, if your work is such that you have to move from one place to another and walk during the day, then I mean that you are fine, because in terms of your occupation, you already have some physical activity you do over there, so it's not much of a challenge for you. But I mean, those of us who are sedentary, we have to try.
So I have 2 more questions. I mean, but this is more into physical therapy. But I mean, I'm sure it's still within the exercise discussion. So when you go to the gym, there's this thing about heavy weight or lower weight, more reps.
Okay.
Which of them is good? Which of them does what?
So it depends on what you want to do. So if you want to build muscle, then you'd have to progressively overload the muscle.
Okay.
So you have like there's an overload principle. You have to subject the muscle to a load that is higher than what is used to. So that's why when you go, you have to progress. Like they'll be saying, oh, yesterday you did 50 kg, today I do 55. Because you have to progress if you want to build the muscle. But if you are looking at endurance, okay, so you are looking at, oh, I just want to have a strong heart and everything should be just okay. I'm not looking at building muscles. Then with that, you can do more reps, but not necessarily increasing the load.
So then that means that you can have big muscles and no endurance at all.
Yes, yes, it's very, very possible. It's very, very possible. It's very, very possible. It doesn't go together. It's very, very possible that you might see a bulky individual, but ask the person to sprint from here to here, and you might probably end up winning. Yeah, so it's different. It's different.
And then, so now my second question is related. So you talk about overloading the muscle with what is not used to build bulk. But then, so I mean, you go to the gym and then they put the weight on, and then you are struggling, but then the trainer now wants to help you lift it. Now I keep getting confused with that concept. Why do I get any benefit if there's somebody else pushing the weight along with me? Why not give me a weight I can actually manage? I don't know.
Okay, so it's called sparring. Like you help like the spar. So so the thing is the trainer is trying to progress you, because I mean it's kind of like you have to get out of your comfort zone.
True.
No pain, no gain, that whole concept. See, so you will be struggling. I mean, but then the trainer is probably trying to see the level at which you can get to. But ideally, there's actually to do it to evaluate if the person will struggle. You can do 10 reps of it and see how the person manages with it, and then you can determine that, oh, okay, if they can do 10 reps easily, then I need to progress to the next one. Or if they struggle with this 10 reps, then let's reduce the reps to 8 and see. So I mean, there's a way of doing it, but sometimes because the physical trainer is supposed to be working with apparently healthy people, their aim is to push you to your limit.
Then they will shout, you shouting lightweight. The way I hate that thing. Anyway, there's a question. There's a question on the platform. Daniel wants to know how much walking is enough.
How much walking? So if it's brisk walking, so generally it's supposed to be a minimum of 150 minutes of moderate intensity physical activity a week. So it will depend on how you are structuring it. Are you doing it for 3 days? Are you doing it for 5 days? I wouldn't recommend you do it all in one day. So it would depend. But if it's walking, then you have to do brisk walking. You have to do brisk walking. If it's for 30 minutes that you are doing the brisk walking, you're probably walking at 4 to 5 kilometers per hour, or around 3 miles per hour. So it's like pretty fast walking. It's not like the slow walking that just using.
I mean, the idea is to be able to have a conversation but not sing. So I mean, push yourself.
Yes. So you should feel that your heart rate, or your heart is pumping. You should feel that your heart rate is going higher and that you are panting. Yeah,
I agree.
To feel it.
And I think what I'd also like to add is, I mean, so that you can fix the time and then vary the distance. So if today you're able to do 10 meters in the 20 minutes or so, tomorrow try and push it to 20 meters in that same time frame. So that you are challenging yourself, and that's something
so
I
every exercise there has to be progression.
Exactly. So that it's just like the weightlifting. Then you shout lightweight and then you are moving. All right, Amelie, you're welcome. Well, you missed a lot today. We are discussing exercise and cancer, and so far, William has given us a lot of information about exercise and how it relates to cancer. and how it helps you to reduce obesity. And obesity itself is also an independent indicator of your cancer risk. And so exercise is very, very, very important. It cannot be overemphasized. You know, a lot of people think, and maybe I'll throw this back to you. A lot of people think that they exercise only when they want to lose weight. And so if they are not overweight, why should they exercise? So maybe you can just use that to summarize all that you have said so far,
Okay.
so that Gameli
Okay.
can catch up.
Okay. So apart from obesity or exercise being used to reduce obesity, because people who are typically obese are at a higher risk of cancer. Also, when you exercise, the benefits is that regarding the hormones, estrogen. Okay, so apparently when you have high levels of estrogen, you are at a high risk of cancer. Okay,
Especially
so
breast cancer.
what happens is when you exercise, what happens is that there are some proteins that bind to estrogen. So these they are elevated when you exercise. So these proteins are elevated, and then they're able to bind to the estrogen, and that lowers the level of estrogen in the serum or in your body. Then regarding insulin too, we've also realized that high levels of insulin is linked to cancer. So what happens when you exercise is that the body, the receptors that are supposed to help insulin to take up glucose, blood glucose, those receptors are more sensitized. So insulin is able to perform its function to take up the blood glucose. So all those things help to reduce those levels of the insulin and the estrogen. And that's what puts you at a lower risk of having cancer. So those are the benefits. And then generally we know that exercise helps to boost your immune system. Generally, that's something we know. So that one is also a benefit of exercise. You know, along with the other ones of it's boosting your mood and all that, sex drive. But yeah, regarding cancer, these are like the main reasons. So if you are not even obese, you still have to exercise so that the high levels of these chemicals in your body will be reduced.
And exercise also works on your mood. It makes you happy. I mean, Charlie, you have to exercise. Some fresh air is always nice.
So it's a win-win.
It is. And so Belial has a question. I think you addressed it earlier, but I mean, I just want to, since she's asking, is being physically active every day without necessarily exercising good enough?
Yes. So as I said, exercises are structured, they're planned structured, they are repetitive, and they have a purpose. So exercises are more specific, you know, like, and there's a time frame. You want to do 20 reps of biceps within 2 minutes or within 20 seconds. It's specific. But physical activity is a wide range. It ranges from walking, playing with the kids, and walking the dog, mowing the lawn, mopping the floor, sweeping the floor, cycling. I mean, it's a wide range. It's anything, like any activity basically that expends energy, that you feel you are using it to expend energy. Anything you are doing, it falls under it. So you can use daily activity. You can use chores, household chores, as a means to also do some form of physical activity to help you lessen your risk of cancer. You just have to be active. That's the whole point. Be active. So it doesn't have to be exercise per se, but yes, physical activity, walking, taking your car for errands, or taking the stairs instead of using the lift or the elevator. All those things play a role. Okay. You can bike, yes. You can use a bike instead of yes. Instead of always being in the car or something.
And dancing. Gameli says dancing.
Dancing is a great way. Like the Afro beats, you can just put on some Afrobeat tunes and just do some moves for some 30 minutes. And you start sweating, you feel yes, you're working out, because those moves are very, very high impact. They're very intensive.
And even exercise can reduce your bill, because when you exercise and you're sweating, you don't need to bath hot water, so it reduces your electricity bill.
Yeah, that's a good one. That's a good one.
I have learned a lot. I mean, in fact, what the later one you added about the hormones was very enlightening. Estrogen and then insulin. I mean,
Insulin.
that was very, very enlightening. And I mean, I have learned a lot, and I'm sure that those guys who have joined us have also learned a lot. And so there is a link between exercise or the lack of it and cancer. So please, whether you are obese or overweight or not, you need to exercise. You need to make it a part of your daily activities. And if you cannot carve out time for exercise as defined, it has to be purposeful, it has to be repetitive, it has to be towards a particular goal. If you cannot find time to do that every day, then turn your daily activities into a form of physical activity. So instead of sitting in a car, you can walk, and that will also save you fuel, because if you're in Ghana, you know that the fuel prices are going up. So if you can walk to work, Charlie, make it a part of your routine.
And we are saving the environment. We're
Exactly,
saving the environment too.
exactly. So instead of using the elevator, you should climb up the staircase. Even though it may not be exercise as defined, it is still physical activity, and you will get the benefits out of it. Instead of sending somebody to go and buy the food, get up and go and buy it. In fact, be the person that everybody gives to go and buy the food, so that can be your physical activity for the day. So these are all the little things that you can do to improve your own life, because the fact of the matter is that cancer is becoming quite common in our setup in Africa, in Ghana, because in fact they call it a double burden of disease. We haven't finished dealing with the infectious disease, so we still have the malaria, we still have the diarrhea, we still have pneumonia and other things still killing our people. And then on top of that, we also have the non-communicable diseases like hypertension, diabetes, and now cancer. And this month of October is breast cancer month, and I mean, in case you are not aware, in Ghana, over 4,000 new cases of breast cancer are diagnosed every single year. So it is still a big deal, and about 1,800 of them die every single year. So yes, they talked about the No Bra Day, and all the guys were excited and were making noise, but hey, it's for a very, very important thing. Get yourself examined, get yourself screened, so that if anything, the whole point of screening is to pick up the disease even before the disease shows itself. And at that point, a lot can be done about it. So don't take it lightly, get screened, and then take these education sessions seriously, because hey, it's free. It's free. Those of you that joined this one, you've learned a lot of things for free. People usually have to pay to have Wayram sit them down and talk to them. So if you are getting it for free, take advantage of that. Now Wayram, Wayram is on the call with her IG. What's it called?
Rante Fitness.
Yes, her at Rante Fitness. You can follow her, and then get some good advice from her as well. And of course, when it comes time to pay, you have to pay. Because it's not every day that we do free things. But if you are here and you've had a good time, please drop some heart. Let me know that this has been worth your while. I have had an amazing time. I've learned a lot, and I know that I hope that you have also learned a lot as well. So Wayram, thank you very much for spending this time with us and giving us, all this information. It's been amazing. It's been great catching up as well.
Thank you for having me. It's been amazing. I'm glad to share.
Wonderful. All right, guys. So thank you very much and have a lovely time. You can catch a replay of this session on my YouTube channel, Ask Dr. Kelvin. And leave a comment, like, share, subscribe, all of those things. So thank you very much. Have a lovely evening, guys. Stay blessed. See you later. Wayram, we'll talk.
Okay, bye.
Bye.